My name is Tiana Jackson. I'm going to be conducting a head-to-toe assessment for spring 2026. This is my patient Ebony, and I'm going to start off by doing a 360 of the room. Alright, so alright, there's my tools, supplies, the floor, and then the ceiling. Alright. So I'm going to start off by doing an overall assessment of the skin. Due to the patient's privacy, I already inspected the posterior and anterior chest and then the abdomen. So the skin is appropriate for ethnicity. The temperature is warm. The texture is coarse and the moisture is dry. There's no edema. The skin turgor is elastic. There's no bruising, scarring, lesions, or nevi noted. So then we're going to move on to the head. The head is cephalic and midline for the patient's body type. We're going to move on to the hair. The hair is equally distributed. I'm going to touch. There's no infestations, no depressions, no tenderness, no mass. The hair color is appropriate and the hair texture is coarse. So then I'm going to move on to palpating the temporal arteries for any tenderness, and no tenderness was noted. So then I'm going to move on to palpating the lymph nodes. So we're going to start with preauricular, postauricular, occipital, tonsillier, anterior cervical, posterior cervical, submandibular, submental, and supraclavicular. Alright, there was no nodules noted there. So then I'm going to move on to palpating the TMJ. So I'm going to get you to open and close your mouth. Alright, there was no crepitus, no subluxation, and no tenderness noted there. So then I'm going to move on to cranial nerve number 5, trigeminal, testing for motor first. So I'm going to put my hand on the masseter muscle, and I'm just going to clench your jaw. Alright, there was no tenderness noted there. So then I'm going to move on to sensory with the cranial nerve number 5. So I'm going to get you to close your eyes and let me know where I touch you at.
Forehead, cheek, nose, chin, cheek.
Alright, cranial nerve number 5 is intact. So then I'm going to move on to cranial nerve number 7, testing for facial symmetry. So I'm going to get you to smile, frown, raise your eyes, poke your lips out, and puff your cheeks. Alright, cranial nerve number 7 is intact. So then we're going to move on to assessing the ears. The outer shape of the ears, making sure the ears are symmetrical and appropriate for the head size, which it is. I'm going to palpate the tragus and then the pinna for any masses or any tenderness, and none was noted there. So then I'm going to move on to assessing the auditory canal and the tympanic membrane with my otoscope. The auditory canal was clear. The tympanic membrane was pearly gray. So then I'm going to move on to testing for cranial nerve number 8. We're going to start off with a whisper test. So I'm going to close this one ear over here. You're going to repeat the words that I say.
Cat, dog.
Alright. We're going to move over to this side.
Cat, dog.
Alright. So cranial nerve number 8 whisper is intact. We're going to also test for Weber in the cranial nerve number 8 for lateralization. So I'm going to put the tuning fork on the top of your head. You let me know if you hear it on both sides.
Yes.
Alright, so then we're going to test for a Rene test, testing for air and bone conduction. You just let me know which one you hear louder, the first and second one.
Second. Second.
Alright, air conduction is greater than bone conduction with the Rene test. So cranial nerve number 8 is intact. So then we're going to move on to eyes. So I'm going to be looking at her lashes, her brows, and the papillary fissures. Her brows are symmetrical. Her lashes are equally distributed in hair, and the papillary fissures are intact. So then I'm going to assess the conjunctiva and sclera. So I'm going to get you to look up while I hold this down. Alright, the sclera is white and the conjunctiva is pink. So then I'm going to move on to cranial nerve number 2, optic, and that's assessing for visual acuity and using the peripheral and central vision. So I'm going to get my chart. This will be at a 20 feet distance, but for this, I'm going to get you to close one eye, and then you're going to read the smallest line for me.
DHJBS.
All right, using the other eye.
DHJBS.
Alright, with both hands down.
DHJBS.
Alright, the patient's vision is 20/20. So then I'm going to move on, testing for cranial nerve number 3, making sure direct and consensual vision is appropriate with pupillary response to light. So I'm going to use my pen light. Okay, I'm going to come on to the side. Alright, the pupils are equal, round, and reactive to light with 3 millimeter in size. So then I'm going to test for accommodation and convergence. So I'm going to get you to look straight, pen light. Alright, accommodation and convergence is intact. So then I'm going to move on to cranial nerve number 3, 4, and 6. Testing for ocular motor, trochlear, and abducens. This one is the 6 gazes of extraocular movement. So I'm going to get you to follow my pen light. Alright, cranial nerve 3, 4, and 6 is intact. So now I'm going to assess for your red light reflex using my ophthalmoscope and looking at other internal optic structures. Alright, just look straight for me. Alright, now look to the side. Alright, the red light reflex is intact. There's no damage to the other optic structures inside. So then we're going to move on to our nose. I'm making sure the nose is midline and symmetrical on the patient's face. Everything looks symmetrical, no damages. So we're going to test for cranial nerve number 1, olfactory. So I'm going to get you to hold down one nostril and tell me what you smell.
Alcohol.
Alright, we're going to hold down the other nostril.
Alcohol.
Alright, I'm going to get you to hold one nostril again and blow out. Alright, I'm going to do the other side. Alright, our nose is patent with no obstructions. So then we're going to move on to testing for frontal and maxillary sinuses. So I'm just going to massage here. Alright, and no tenderness was noted there. So then we're going to move on to testing for looking at the throat and the mouth. So we're going to be looking at the lips, the gums, the buccal mucosa, the palate, the top of the mouth, under the tongue, the posterior pharynx, the salivary ducts, and also the tonsils. So I'm going to get you to open your mouth. And I'm just going to have a look around. Alright, so everything looks intact. All teeth is there. The buccal mucosa is moist. There's no damages to the internal structures. The tonsils are non-existent, so there's no need of grading there. So then I'm going to move on to cranial nerve number 9 and 10, testing for a soft palate and uvular rise with phonation. So I'm going to get you to stick your tongue out for me and say ah. Alright, so cranial nerve number 9 and 10 is intact. The uvula rose and the soft palate rose with phonation. So I'm going to test for cranial nerve number 12 now. We're going to see if the tongue is midline without falsification. Open your mouth. Alright, and then stick your tongue out, go left, go right. Alright, up, down. Alright, cranial nerve number 12 is intact. So then we're going to move on to the neck. So I'm going to palpate your trachea. And then I'm going to turn your head a little bit. I'm going to palpate for your thyroid gland. Swallow for me. Alright, we're going to turn your head that way. I'm going to put it right here. Swallow. Alright, the thyroid gland was non-palpable. So then I'm going to move on to assessing the carotid artery. So I'm putting my hand right here. Okay, and I'm going to assess on this side. Alright, the carotid artery was 2 plus in pulsation. And then I'm going to use my stethoscope to test for the carotid artery for any bruits. Using the bell of my stethoscope. Hold a deep breath, hold it. Alright. Hold it. Alright, no bruits were noted there. So now I'm going to move on to my posterior chest. So I'm going to get you to turn around. Alright, so now we'll move on to the posterior chest. We're going to assess the overall appearance, make sure there's no obvious deformities. We're going to be assessing to make sure the patient isn't showing any signs and symptoms of respiratory distress. So making sure the patient is not using no accessory muscles, no retraction, no tripod position, no nasal flaring, no tachypnea showing, or no cyanosis. None of those are noted. So I'm going to start off by palpating for chest extension. So I'm going to put my hands right here, take a deep breath. Alright, the chest rose symmetrically, so I'm also going to palpate for tactile firmness. So every time I touch it, say 99.
99.
Alright, equal vibrations heard throughout both lung fields. So then I'm going to percuss in the intercostal spaces. All right, residents heard throughout. So now I'm going to move on to auscultating those lung spaces. I'm starting from the scapula, going all the way down to the lung bases. All right. All right, the lungs were clear to auscultation, so I'm also going to auscultate for egophony. So every time I touch her, say E.
E, 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 E,
All right, I'm also going to test for bronchophony, so every time I touch you, say 99.
99, 99, 99, 99, 99, 99, 99, 99.
All right, and next I'm going to test for whisper practicality, so every time I touch you, whisper 99 for me. All right, so now I'm going to get you to turn around. We're going to inspect the anterior chest. All right, so we're going to still do an overall inspection, making sure there's no obvious deformities, making sure everything is symmetrical and no respiratory issues on the front side. So I'm going to go ahead and palpate for chest expansion anteriorly. All right, take a deep breath for me. All right, the chest rolls symmetrically anteriorly, so then I'm going to palpate for tactile firmness as well. So every time I touch you, say 99.
99, 99, 99, 99.
All right, equal vibrations heard throughout anteriorly, so now I'm going to auscultate those lung spaces anteriorly. All right, clear auscultation, they're heard throughout anteriorly. So now I'm going to move on to my cardiac areas. So I'm going to start with the aortic, which is your right sternocleidomastoid, second intercostal space. We're going to go to pulmonic, which is your second sternocleidomastoid, second intercostal space. We're going to go to Erb's point, it's your left sternocleidomastoid, third intercostal space. Our tricuspid, which is our left sternocleidomastoid, fourth intercostal space. And we're going to go to mitral, which is our mid-clavicular fifth intercostal space, which is also our point of maximum intensity. So I will palpate that for a full minute to get my apical pulse, and it'll let me know my rate and my rhythm. Okay. All right, so I'm also going to use that. I'm also going to do the bell of my stethoscope as well. So aortic, pulmonic, Erb's, tricuspid, mitral. All right, so now I'm going to get the patient to lie down. All right, so we're going to inspect the overall chest too as well. So first I want to start off by assessing for jugular vein distension. So I'm going to lift the patient up to a 30 to 45 degree angle, turn the head that way, and I'm going to look. All right, I'm going to lay you back down. So the jugular vein was non-distended. There's no visual pulsations noted. I'm also going to inspect for any heaves or lifts, and those are none noted. I'm going to palpate over those 5 Craig marks for any thrills. So aortic, pulmonic, Erb's, tricuspid, mitral. No thrills were noted there. So I'm going to also auscultate those areas as well. So aortic, pulmonic, Erb's, tricuspid, mitral. Using the bell of my stethoscope, aortic, pulmonic, Erb's, tricuspid, mitral. All right. So now I'm going to move on to the abdomen. The abdomen's contour is rounded and protruded. Everything looks symmetrical. I'm going to move on to auscultating for any bruits. We're going to start off with the bell of our stethoscope, going to the aorta, renal arteries, iliac arteries, femoral arteries. No bruits were noted there. I'm going to go ahead and auscultate for any bowel sounds in our 4 quadrants. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. all those vowel sounds were normal active. So then I'm going to move on to percussive. All right, take a deep breath. All right, so Tiffany was heard throughout. There was dullness over the liver, and it was Tiffany heard over the spleen. So now I'm going to palpate for any masses or any tenderness. All right, there was no masses, no tenderness noted. So now I'm going to palpate the liver and the spleen. And then spleen. All right, those were non-palpable. So now I'm going to get the patient to sit back up for me, and I'm going to get you in the chair with your back facing the camera. All right. So I'm also going to test for CVA tenderness now. Any tenderness noted? All right. So now I'm going to get you to turn back around. So now we're going to move on to musculoskeletal. So in this area right now, I'm going to be assessing your hands, your wrists, your elbows, and your shoulders. Okay, so first I'm going to get your hands out. I'm going to test for capillary refill. All right, capillary refill was less than 3 seconds. I'm going to test your radial pulses. All right, your radial pulse was 2 plus. Just touching the patient is warm. There's no nodules, no crepitus, no edema noted. There's no redness, no swelling. So now we're going to do range of motion with our hands. So we're going to start with flexion, extension, hyperextension, abduction, adduction, thumb opposition. All right, you got full range of motion with those. So then we're going to do wrist. We're going to do flexion, extension, hyperextension, radial deviation, ulnar deviation, rotation. All right, you got full range of motion with those. So we're going to do elbows now. So flexion, extension, hyperextension. All right, you have full range of motion with your elbows. So now we're going to do shoulders. So we're going to do flexion, extension, hyperextension, internal rotation, external rotation, abduction, adduction. All right, and then circumduction. All right, so then we're going to test for strength. So I'm going to get you to squeeze my fingers. All right, you got 5 out of 5 strength with your hands. So then we're going to do bicep and tricep strength. So do your arms like this. All right, push forward and then pull. All right, you have 5 out of 5 strength with your bicep and tricep. So I'm going to get you to put your arms straight out. All right, try to lift up and then lift down. All right, you got 5 out of 5 strength with your shoulders. And then I'm going to test for cranial nerve number 11, accessory. So I'm going to get you to test for struggle resistance. Try to lift up. All right, cranial nerve number 11 is intact. So now we're going to move on to cerebral coordination. So we're going to start off with serial finger opposition. So you just do what I do. And then go backwards. Good job. So then we're going to test for head flip-flop. So we're going to start off with pronation, then go supination, then go fast. All right, good job. So then we're going to go testing for finger to finger. So touch your nose and then touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. All right, we're going to do the other side. Touch your nose, touch your finger. And then touch your nose, touch your finger. All right, cerebral coordination is intact. So now we're going to assess for stenosis. So I'm going to get you to close your eyes and you're going to identify the object that I place into your hand.
Pierre.
Okay. And the other hand.
Spoon.
All right, good job. So you can go ahead and open your eyes. So this next test is going to be testing for graphthesia. So I am going to get you to close your eyes again. You're going to open up one hand, and I'm going to draw something in your hand. You're going to let me know what it is.
C. T.
Okay, and what's the other side?
B. T.
All right. All right, graphthesia is intact. So then we're going to move on to just assessing the overall upper and lower extremities. The skin integrity is intact, the color is appropriate for ethnicity, and there is no edema noted. So I'm going to also start off by testing for light sensation. So you just let me know where I touch you at. Go ahead and close your eyes.
Arm, leg.
All right, light sensation is intact. So now I'm going to test for vibrational sensation. So So I'm gonna start with, I'm gonna get you bigger arms kind of like this. Yeah. So you feel on your wrist?
Yes. Yes.
Alright, your ulnar prominence.
Yes. Yes.
Alright, your medial malleus.
Yes. Yes.
Alright. So now we're gonna test for deep tendon reflexes. So we're gonna start off testing for your brachioradialis. Alright, do the other side. Alright, we're gonna do bicep. Alright, we're gonna do tricep. And do the other side. Relax. Alright, we're gonna do patella. Relax your legs for me. Alright, and then we're gonna do Achilles. Alright, and we're gonna do Babinski. Alright. Alright, deep tendon reflexes are intact. Alright, so now we're gonna move on to your lower extremities. So now I'm gonna be looking at your feet, your ankles, your knees, and your hips. Alright, so just assessing the overall appearance of these. There's no redness, no swelling, no obvious deformities. There's no edema, no nodules, no crepitus noted, and no tenderness. So first I'm going to start off by assessing for capillary refill in her feet. Alright, capillary refill is less than 3 seconds. I'm also going to palpate those pulses. So dorsalis pedis pulses, okay, and then posterior tibial, and those are both 2+. So now we're going to start off our range of motion in our toes, okay? So we're going to do the same thing kind of like before. So flexion, extension, hyperextension, abduction, adduction, okay? You have full range of motion in your toes. So then we're going to move on to ankles. So plantar flexion, dorsiflexion, internal rotation, external rotation, rotation. I already got full range of motion in your knees. So now we're going to do a strength test. So I'm going to get you to place your feet back up on there. Okay? I'm going to get you pushed down and push up. Alright, you have full range, full strength in your knee, in your ankles. Sorry. So then we're going to do your knees. So I'm going to get you to push forward and then push back. Alright, you have full range of motion in your knees. So then now I'm going to get you to stand up. Alright, so now we're going to test for range of motion in your hips. So we're going to start off by flexion, extension, hyperextension, alright, adduction, abduction, alright, internal rotation, external rotation, and then circumduction. Okay, we're going to do the other foot. So flexion, extension, hyperextension, adduction, adduction, internal rotation, external rotation, circumduction. Okay, so now we're going to do our knee. So flexion, extension, hyperextension. Alright, going to do the other side. Flexion, extension, hyperextension. Okay, you got full range of motion with that one. So now I'm going to get you to turn, and I'm going to assess the overall spine, make sure everything is symmetrical, no obvious deformities. I'm going to get you to lean forward a little bit. I'm going to look at the scapulas. There's no kyphosis or scoliosis noted. So while we're like this, I'm going to go ahead and do flexion, extension, hyperextension. Okay, your lumbar got full range of motion. So we're going to do cervical. So extension, flexion, extension, hyperextension. Your cervical spine has full range of motion. So then I'm going to get you to turn this way and put your hands up. Alright, Romberg is intact. So I'm going to get you to walk towards the camera, heel to heel. Alright, and backwards. Alright, gait and tendon was intact. And then I'm also going to get you to hop on one foot. And then the other foot. Alright, and my head to toe is complete.